With the increased rate of obesity and the rising cost of healthcare, personal health and fitness are more important than ever. What doctors and trainers need is real science that provides them with real answers. KORR Medical Technologies has answered that challenge with metabolic testing through oxygen uptake, the key to healthy weight loss and effective cardiovascular training.
My name is Joe Rogowski. I'm a trainer for professional basketball athletes, and I've been using the KORR Cardio Coach for about 5 to 6 years now. The Cardio Coach is a metabolic cart that we use that's very portable, easy to use, that allows us to test our athletes from a physiological standpoint. It gives us anything from heart rate to lactate threshold to VO2 max. It's very user-friendly. I mean, it's a lot of touch buttons. You can actually hook it up to your laptop and work off of that. And you know, for the most part, all you have to do is hit start and it runs itself. There are other pieces of equipment out there, but just through my research and my own testing, this equipment seems to be the most reliable and the most valid. It's quick and easy, and that's what you're looking for as as a trainer, something that's quick and easy and comfortable for the patient or athlete to use. I've worked with some Olympic athletes as well, and some athletes that were in Beijing, and specifically the Lopez family. I tested them out, and we were able to track their lactate thresholds and their heart rates, and see a significant improvement prior to the Olympic Games and when the Olympic Games actually came about. And we were able to analyze and see the significant difference, and that's, I think, one of the reasons that helped them medal at the Olympics. My favorite thing about using it is just the amount of data it gives you, and it allows you to be creative as a trainer, as a medical personnel. Whatever your area of expertise is, it sort of allows you to dictate what information you want to give the athlete or the person that you're testing, and formulate a different plan of action for them and how you want to train them personally. And it gives the person that you're testing some confidence that you are directing this personally for them and not just taking a cookbook approach. As a trainer that works with high caliber athletes, you're looking for any advantage you can over the competition, and so you're always looking at the newest technology and what can benefit your players, your athletes the most. The KORR medical, VO2 cart is actually something that we've seen some positive results with, and so we utilize it.
Yeah, so in our medical weight loss clinic, we have the Review metabolic tester. It tells us how many calories your body burns at rest in a day. So with that information, we take that information, we set a diet according to how many calories your body burns in a day. It's simple. It's very, very easy. The test takes about 10 minutes. The clients feel like they're getting a really good assessment. They're all interested in what their metabolic rate is. Testing someone's metabolic rate is just key to find those few people who lie outside the norm, who have slow metabolic rates. They're frustrated, they're upset because they can never ever lose weight. I had a client who exercised nonstop, dieted, just an incredible diet, cut her calories so low, but through this process had dropped her metabolism to just a very low rate. It wasn't until she came to our clinic, we checked her metabolism with the Review, that we found out that she had a really low metabolism. Once we found that out, we were able to increase weightlifting, increase exercise that will increase her metabolic rate, put her on a diet that was in a range for her to lose weight, and she had a lot of success. But unless we were able to use the Review, find out what her metabolic rate is, we would have never known that.
My story was I was hospitalized for surgery. I woke up on life support due to being too obese to have the procedure done, and from that point I decided I was going to lose weight. I hired a trainer. The trainer put me on a 1,600 calorie diet. I only lost 8 pounds that month. I found the KORR calorimeter, changed my calories to 2,400 calories per day, and I lost 86 pounds in the last 8 months. My trainer had me on a 1,600 calorie diet. The KORR Metabolic Analyzer put me on a 2,400 calorie diet because everybody's body composition is different. My metabolism burns faster than a 1,600 calorie diet. With the 1,600 calorie diet the trainer had me on, I lost 8 pounds in a month. With the 2,400 calorie diet the review had me on, I lost 28 pounds the next month. Needing to eat 2,400 calories versus 1,600 calories was a big surprise to me. Never would have thought I had to eat more calories to lose weight more comfortably. Being able to do things with my family, such as ride a roller coaster, fit in an airplane without using a belt extension, and just overall health, being happy, jolly, and being able to travel much more efficiently.
I'm Julie Kofed. I'm a registered nurse and Vice President of Marketing at KORR Medical Technologies. At KORR, we manufacture products for both fitness and medical applications. The CardioCoach and MetaCheck are intended for fitness assessments and non-medical applications, and the review is FDA approved for making medical decisions. Within medicine, any physician who is seeking to improve a patient's health by treating obesity will benefit from the FDA approved review. Obese patients with cardiovascular disease, hypertension, diabetes or pre-diabetic state, thyroid disorders, and sleep disorders will all have an improved quality of life and an increased lifespan when the appropriate measures are taken to decrease their weight. Studies show that a short 3 to 5 minute conversation during routine visits can contribute to behavior change, and that patients are 3 times more likely to try to lose weight when the advice comes from their physician. The RMR test engages the patients in that 3-minute conversation as it opens their eyes as to what is really going on inside their own body. It allows the doctor to screen for any patients who might actually have a slow metabolism. And for the majority of us, it eliminates any excuses for why we can't lose weight because it shows us just how many calories we really do burn in a day. In addition to the initial screening, an RMR test should be repeated. It's important to evaluate the effect that a weight loss program may be having on a client's metabolic rate. We've all heard of the dreaded weight loss plateau. Well, that is most likely caused by a decrease in RMR that needs to be adjusted for. Maintenance is another crucial time to measure RMR. After a significant weight loss, regardless of the method, your metabolic rate is likely to be depressed, lower than your lean body mass would indicate. Now, studies suggest that it will eventually rise back up to where it should be. But during those first few months, that decreased RMR makes it very easy to gain weight. Monitoring it closely to assist your patient to stay on track is key to successful maintenance. Now I'd actually like to show you just how easy it is to do a resting metabolic rate test with a KORR product. It has self-calibrated, actually a really unique feature of a KORR metabolic analyzer. And it keeps it extremely accurate, more accurate than anything else out there on the market. By the way, did I mention that it is CPT coded for reimbursement, reimbursed by Medicare and most insurance companies out there? I'm going to extend the MetaBreather and connect it to the opening, and then have Allie put it in her mouth and make a nice seal around the edges. By putting the nose clip on, we assure that all the air she breathes out goes into the box, and then we can assess just how much oxygen she's consumed. She can relax either in a sitting or lying position, and after about 10 minutes, it'll beep and let us know that the test is complete. That's all there is to it. When the test is complete, you simply take these things down, enter in some basic data, and then the results print out. This printout makes explaining the results to your patients a breeze.
My name's Joe Orr. We started the company in 1994. Our first customers were medical device companies, and our products have gone into products manufactured by some of the largest medical device companies in the world now. Before the company was even started, I was a graduate student at the University of Utah, and I was assigned a project to build an instrument to measure metabolic rate and oxygen uptake for NASA astronauts. We put together an instrument that they could use during exercise and during resting to measure how many calories they burn. We've done studies where we bring in people and test them on existing devices and measure their oxygen uptake. We test them on our instrument. We've done studies where we put one in series with the other, so at the same time they both measure the same thing. And then as well, other places at other universities, USC and other places have done tests with our instruments and found them to be accurate as well. Well, we've been in business for 16 years. We'll be in business for at least another 16 and hopefully more than that, and hopefully we'll grow. We're on the cusp of some big things.